All right, hello everyone. Oh, let me take my mask off here. I keep forgetting that I have it on sometimes. All right, hi, happy Friday everyone. I'm Dr. Rendy Murphy, epidemiologist and director of disease surveillance here at the Mobile County Health Department. Here on Friday, October 16th, to give you our 2:30 update on the impact of the COVID-19 pandemic on Mobile County. So we'll start with the global numbers: over 39 million cases and over 1.1 million deaths. So about 25%, 20 to 25%. Yeah, that's not 25%. Sorry, let me start over. 39 million cases and 1.1 million deaths. All right, in the U.S., we have 8 million cases with around 218,000 deaths. The U.S. is still leading the globe in the number of cases and deaths, followed by India and Brazil. And in Alabama today, reporting on 170,374 cases with 2,786 deaths. So the death rate for Mobile County and the state runs anywhere from 2 to 3%. So for Mobile County today, we're reporting 14,198 cases of COVID-19. Since we spoke to you on Monday, we have added, yesterday 41, Wednesday 68, that was a little bit of an increase, Tuesday 37, and Monday 43. So I think the interesting thing is that we had been seeing sort of a steady decline in the number of cases, but in the last 7 days, our case count is about 26% higher than it was the previous 7 days. So it does look like we may be ticking up a little bit in the number of cases. We have 315 people who have died with COVID, and 2,160 cumulative number of people hospitalized with COVID-19 disease. That's an increase of 7 since yesterday. And our current hospitalization number yesterday was 73. So it looks like the hospitalizations is actually trending flat or perhaps down a little bit. It's looking better. It had been going up weekly for 3 weeks, but it looks like it's going down now. So we still want to emphasize that we know that transmission in the younger age groups, it's what's driving community transmission. And again, we need you folks who are, high school, college age kids and adults to make sure that you are wearing your mask and socially distancing to try to continue to slow the spread of COVID-19, but more importantly, to protect those that are most vulnerable to complications and deaths. So yesterday, actually, the Alabama Department of Public Health Risk Indicator Dashboard was updated. So it's one that gives you the map. It was updated yesterday. Usually that happens on Fridays, but it went up yesterday. And it's based on sort of the previous couple of weeks' data. There's a little bit of a lag now, or a lag in that data. But the good news is that Mobile County is back in the low risk category. So the low risk COVID category, and that is because we've had a 14-day trend and declining number of cases. The percent positive laboratory tests have been less than 10%. Ours are around 4 to 5%. We have met our testing goal. So the testing goal is around 1,800 cases per week for Mobile County, and we have been seeing about by week, and we've been seeing about 6,000 on average. And then the emergency department visits for COVID-like symptoms has been on the decline, and it is showing that emergency department visits for COVID-19 have been declining in recent weeks. So that is really good news. All right. So enough about the data. Just wanted to mention an MMWR report. So this is the Morbidity and Mortality Weekly Report that CDC publishes. Had a great article on looking at race, ethnicity, and age trends in persons who died from COVID-19. This is looking between May and August. So, from early summer to late summer. And some interesting things in here, particularly when CDC looks by region of the U.S. So they did some comparisons looking at the South, the West, the Midwest, and the Northeast. Of course, we would be in the South category. They noted from May to August, the percent distribution of COVID-19 associated deaths by region increased from 23% to 62% in the South. And we by far now have the largest proportion. We carry more proportion of COVID deaths than the other three areas of the U.S. combined. So 62.7% of deaths in August occurred in the South. Just really brings home sort of how, even though things are getting better here, that we still have a long way to go in preventing illness and preventing deaths from COVID-19. The report goes on to remind us that deaths continue to occur disproportionately among older persons and particularly among Hispanic persons. So we continue to see those health disparities play out with race and ethnicity, and then of course our older community members are at greatest risk of death. So less than 6% of the deaths nationwide, and this was around 114,000 deaths, less than 6% were under the age of 50. So that's really good news for young people. That means that 94% of all of the deaths occurred in people 50 and older, and somewhere around, 56% are in 75 and older. So definitely COVID hitting those older community members and family members and loved ones harder than those of us that benefit from younger age and better health. So I just wanted to bring those things to your attention in the report that just came out recently. One of the things that people also ask me about this quite a bit, so I might just mention this, the place of death in this report, and 64.3% died in healthcare settings, so they were inpatients. 21.5% died in nursing homes or long-term care facilities, and only about 5% of COVID deaths occurred in the home of residence. So some interesting national statistics that were shared by CDC today. So on to some questions from Facebook. Are facilities that perform the FAST test, the rapid test, reporting by means other than electronically to Mobile County Health Department? Well, again, positive and negative COVID laboratory test results are reportable to the state health department. So there was an emergency rule that requires by law that positive and negative tests be reported to the Alabama Department of Public Health. Electronic means is the preferred means, but there are some manual processes by where laboratories that don't have the capacity to send an electronic message, they can manually enter their test results into an online portal. So yes, there are different ways of reporting the lab results. I think this question is really getting at something that I talk about from time to time, that the PCR tests that are run have been coming electronically for some time because these labs, the labs that could perform these tests, were already set up to provide electronic information to the state health department. But with the arrival or the approval, the availability of the rapid test that can be done outside of a fancy laboratory, that can be done in a nursing home or in an urgent care center, in a doctor's office, something like that, these are not traditionally reporting lab results to the state health department. And so we and the state health department and the Centers for Disease Control are working on talking about trying to determine how we're going to handle these rapid test results that are being performed but not reported to the state health department through the preferred means. And this is CDC has been talking to the manufacturers of these point of care tests or these rapid tests to see what solutions are out there. It is complex, and technology is great when it works and when we have it, but it's not always so easy to implement. So we'll continue following the lead of the Centers for Disease Control and the State Health Department on how to handle reporting those rapid test results. All right. Someone asking about wearing masks at football games. So again, this question could say wearing masks in restaurants, wearing masks at football games, wearing masks at volleyball tournaments, wearing masks at the big box stores. You need to wear a mask. There is a Safer at Home order that mandates the wearing of masks. And so if you are not in your home and you are out someplace where you may be around people that live outside of your home, you need to be wearing a mask, a face covering. Wear a mask when you're out in public, particularly when you cannot ensure that you're maintaining a 6-foot distance from people who don't live in your household. So it's not just about wearing a mask at the football game, but about wearing a mask anytime you're outside your home and you are not able to ensure a 6-foot distance between you and other people. All right. Next comment was, someone would like our opinion on companies or businesses that have had a lot of employees teleworking or working from home since the pandemic, who are now deciding to bring their workforce back to the office. So, even the Mobile County Health Department asked non-essential employees to stay at home for a few weeks back in the spring. And we, had to carefully consider these things when we started asking our employees to come back into the office. And so what we are advising is that you carefully follow the guidance for businesses that's published by the CDC and available on their public website. And it walks through entry screening, distancing, disinfection, leave policies, those sorts of things that can help guide and assist any business who is contemplating returning to work, reopening, bringing your employees back, starting a new business, whatever the case. There are guidelines out there. And as long as you can follow the guidelines from CDC and as long as you can comply with the Safer at Home order, then there's no reason that you should not reopen or bring your employees back to work. However, we have made some concessions, for example, for people who are extremely high risk. So if you have a workforce of maybe people who, have underlying medical conditions or being treated for cancer or are elderly, you may consider some special circumstances for them and maybe bring your younger workforce back. But the bottom line is there are ways to safely reopen. And if you would like some guidance on that, if you would like to talk with us and have us help you walk through that guidance and discuss it, we're happy to do that. Just send an email to covid19@mchd.org. All right, last questions. My friends from Tyler, asking about the protocol for voting, that they had gone to vote and no one in the voting location was wearing masks and there was no social distancing. So the Safer at Home order and the statewide mask mandate does make an exception for polling places. And let me just read you what the Alabama Secretary of State, has said about that no one that votes is required to wear a mask when they vote. However, goes on to say that wants to be supportive of the order from the governor and from Dr. Harris for people to wear face coverings. So just because you're not required to wear a mask when you vote does not mean that you shouldn't wear a mask. You should still wear a mask and maintain 6 feet of physical distance from other people when you are waiting in line to vote and when you are registering or signing in and when you go to the voting location, to the booth where you place your vote. So again, just because a mask is not required doesn't mean that you shouldn't wear one. Everyone should please help us keep COVID out of polling locations and wear a face covering or a mask when you go to vote. And please do register to vote. Register to vote early and by mail, absentee ballot if you have underlying medical conditions or you're at higher risk of complications due to COVID. And if you elect to vote in person, please do wear a face covering when you go to the polling location. So with that, I will end our report today. Hope you all have a great, safe, and healthy weekend, and we'll talk to you next week.